Welcome to my lectures. Today I am going to discuss about Rastriya Bal Suraksha Karyakram (RBSK). It's a child health screening and early intervention services under National Rural Health Mission. The Rastriya Bal Suraksha Karyakram was launched in February 2013 by the Ministry of Health and Family Welfare, Government of India under the National Health Mission. The Child Health Screening and Early Intervention Services Program or RBSK is an innovative and ambitious initiative which envisages child health screening and early intervention services. It is a systematic approach of early identification and link to care, to support and treatment for children right from birth to 18 years. Health screening of children is a non-intervention under the school health program. Need for RBSK. Out of every 100 babies born in this country annually, 6 to 7 have a birth defect. In Indian context, this would translate to 1.7 million birth defects annually and would account for 9.6% of all newborn deaths. Various nutritional deficiencies affecting the preschool children range from 4% to 70%. Developmental delays are common in early childhood, affecting at least 10% of the children. These delays, if not intervened timely, may lead to permanent disabilities with regard to cognition, hearing, and vision. There are also groups of diseases which are very common in children. Example, dental caries, otitis media, rheumatic heart disease and reactive airways diseases which can be cured if detected early. It is understood that early intervention and management can prevent these conditions to progress into more severe and debilitating forms, thereby reducing hospitalization and resulting in improved school attendance. The child health screening and early intervention services will also translate into economic benefits in the long run. Timely intervention would not only halt the condition to deteriorate but would also reduce the out-of-pocket expenditure of the poor and the marginalized population in the country. The aim of RBSK to improve the overall quality of life of children, to reduce mortality and morbidity rates among children, early identification and early intervention of childhood prevalent diseases. RBSK objective: early identification and early intervention for children from birth to 18 years to cover 4 Ds: defects at birth, diseases in children, deficiency conditions and developmental delays including disabilities. So this is a objective. Through child health screening, RBSK tries to identify defects at birth, diseases in children, deficiency conditions and developmental delays, and also early intervention services will be provided through RBSK. Let us see the target age group or beneficiaries. The services aim to cover children of 0 to 6 years of age in rural areas and urban slums. In addition to children enrolled in class 1 to 12 in government and government aided schools. The broad category of age group and estimated beneficiary as shown in the table. So there are mainly 3 categories are there. Category babies born at public health facilities and home. Age group includes right from birth to 6 weeks. Estimated coverage 2 crores. Preschool children in rural areas and urban slums, age group 6 weeks to 6 years, estimated coverage 8 crores. School children enrolled in class 1 to class 12 in government and government aided schools, age group 6 years to 18 years, estimated coverage is 17 crores. Mechanisms for screening at community and facility level. Under RBSK, 0 to 6 years age group will be specifically managed at District Early Intervention Center (DEIC) centers. District Early Intervention Centers. While for 6 to 18 years age group, management of conditions will be done through the existing public health facilities. DEIC will act as referral linkages for both the age groups. Immediately after the delivery, first level of screening is done at all delivery points through the existing medical officers, staff nurses and ANMs. After 48 hours till 6 weeks, the screening of newborns will be done by ASHA workers at home as a part of home-based newborn care package. Outreach screening will be done by dedicated mobile health teams for 6 weeks to 6 years at Anganwadi centers and 6 to 18 years children at school. Once the child is screened and referred from any of these points of identification, it would be ensured that the necessary treatment or intervention is delivered at zero cost to the family. It is expected that these services will reach to about 27 crores children in a phased manner. The children have been grouped into 3 categories as we have seen before, owing to the fact that different set of tools would be used and also different set of conditions could be prioritized. Screening at Anganwadi Center. All preschool children below 6 years of age group would be screened by mobile block health teams for deficiencies, for diseases, developmental delays, including disability at the Anganwadi center at least twice a year. Tool for screening for 0 to 6 years is supported by pictorial job aids specifically for developmental delays. For developmental delays, children would be screened using age-specific tools, and those suspected would be referred to DEIC for further management. Screening at schools, government and government aided schools. So, school children aged 6 to 18 years would be screened by mobile health teams for deficiencies, diseases, developmental delays including disability. Adolescent health at the local schools at least once a year. And questionnaire also will be used, preferably translated to local or regional languages, and clinical examination also will be conducted. Let us see the composition of mobile health team. The mobile health team will consist of 4 members, 2 doctors from the Department of Ayush, 1 male and 1 female, at least with a bachelor degree from an approved institution, 1 auxiliary nurse midwife or staff nurse, and 1 pharmacist with proficiency in computer for data management. Selected health conditions for child health screening and early intervention services includes, as mentioned on the screen, defects at birth, deficiency, diseases of childhood, and then developmental delays and disabilities. So children will be screened for all these defects and diseases, and also early intervention services will be provided. Mobile health team. Suggested composition of mobile health team is, as we have discussed earlier, 4 members, 2 doctors from the Department of Ayush, 1 ANM or staff nurse, 1 pharmacist. Composition of toolkit for mobile health team includes equipment for screening including developmental delays. It includes bell, rattle, torch, 1-inch cubes, small bottle with resins, and then squeak, toys, colored wool, vision charts, reference charts, BP apparatus with age appropriate cuff size, manual and a card specific to each age with age appropriate developmental checklist to record milestones, to identify developmental delays, and then age appropriate weighing scale, weighing measuring tape, then mid-arm circumference tape, and then non-stretchable measuring tape for checking head circumference. So let us see DEIC centers, District Early Intervention Centers. Composition of these centers includes medical professionals, 1 pediatrician, 1 medical officer, 1 dental doctor, 1 physiotherapist, audiologist and speech therapist, psychologist, optometrist, early interventionist, special educator, social worker, lab technicians, dental technician, manager and data entry operators. Role of DEIC: providing referral services to referred children for confirmation of diagnosis and treatment, screening children at the District Early Intervention Center, visit all newborns delivered at the district hospital, including those admitted in SNCU, postnatal and children wards for screening all newborns irrespective of their sickness for hearing, vision, congenital heart disease before discharge. Ensure that every child born sick or preterm or with low birth weight or any birth defect is followed up at the DEIC center. All the referrals for developmental delays are followed and records maintained. The lab technician of the DEIC would screen the children for inborn error of metabolism and other disorders at the district level depending upon the logistics and local epidemiological situations. Ensure linkage with tertiary care facilities through an agreed MOU. Rollout steps for child health screening and early intervention services. Identification of state nodal persons for the child health screening and early intervention services. Dissemination of operational guidelines to all districts. Estimation of the state or district magnitude of various diseases, defects, deficiencies, disabilities as per available national estimates. State level orientation meetings. Recruitment of district nodal persons. Estimation of the total requirement of dedicated mobile health teams and recruitment of the mobile health teams. Mapping of facilities or institutions, public and private, for treatment of specific health conditions. Establishment of DEIC at the district hospital. Procurement of equipment for the block mobile team and district hospital as per the list provided in the operational guidelines. Translation of tools, training packages, printing of formats, training material. Training of master trainers. Block micro plan for school and community visits, monthly outreach plan based on the mapping of educational institutions and Anganwadis and enrollment in them. The schedule of visits of the block mobile teams should be communicated to the schools, Anganwadi centers, ASHAs, relevant authorities, students, parents and local government well in advance so that required preparations can be made. Anganwadi centers and school authorities should arrange for prior communication with parents and motivate them to participate in the process. So this is about RBSK under National Health Mission. Thank you.